Hello, I am Dr. Mirela Cherneyanu, and I welcome you to the Wellness Optimizing Warrior MD podcast, the WOW MD podcast. I am not your typical wellness coach, and this is not a typical wellness podcast. Here, I'll discuss educational facts about health, hormones, intimacy, anti-aging, and beauty trends, all very hot topics, to empower you to make great choices when it comes to your health and to your body. I want you to go, wow, I did not know that. Or, wow, this is going to make a great difference for me. Our healthcare system is broken and it needs a revolution. You and I can start one today. I am willing to share my knowledge with the world if you're willing to listen. Let's get started. Hello there. I am really excited about this episode because it addresses the wellness check in a young woman. The stark reality is that many doctors and mid-level providers that provide wellness services for young women and men in general, but specifically for young women, are so overburdened and so overworked that they unfortunately might skim over some very important and critical aspects in the health evaluation for a young woman. Unfortunately, the system is rigged against the customer, patient, and against the physician. So the more informed you are as a healthcare consumer, which means as a patient, the better and most likely you are to get good services when you're coming to see a provider. Even if that provider, physician or mid-level, is overworked and a little rushed, as long as you, the young woman, know exactly what to ask for in a wellness check, then you would likely impress your provider with your knowledge, and the visit will result in a good experience for both you and the provider. Please listen, and if you know of a young woman in her 20s, please share this podcast with her so she can be empowered to know the key things to have evaluated and to ask for when the wellness check is done with any type of provider. So let me start with number one. And again, it's only number one because it's established preference and the way the patient processing is done when someone steps through the door of a medical office for a visit. But it is probably the least favorite health marker for a young woman. That is height and weight. Unfortunately, before a young woman gets to see a physician for a wellness or any kind of visit, she needs to be measured and have what we call the vital signs recorded. The height, the weight, the temperature, the heart rate, and the last menstrual period. Why do I mention this? Because my best friend's daughter told me one time she hates going to the doctor because she has to get on the scale every time. This is a young woman with a very healthy height and weight. That is worse for young women that are dealing with excess weight issues. I've already provided some numbers and statistics in previous episodes, which are impressive, that are considering and discussing the trends of the young female and male obesity. If you'd like to know more on that subject, just go back a few episodes where I started talking about the wellness checks and how important the height, the weight, and the body composition are in our teenagers. That applies to the young adults as well. What I would like to talk about in this episode, and taking just a slight tiny little detour on the topic of height and weight and body composition, is actually the body image, because this is a critical issue affecting many young women in their 20s today. According to a website called nationaleatingdisorders.org, a negative body image involves a distorted perception for one's shape and physical appearance. Negative body image, also called body dissatisfaction, involves feelings of shame, anxiety, and self-consciousness. That might include perceptions of one's skin color, physical features, hair texture and color, ability status, maybe gender identity and expression, maybe muscularity, as being somehow flawed in comparison to others. And these young women, as well as young men, are more likely to suffer from feelings of depression, isolation, low self-esteem, and eating disorders. Now, it is unknown what exactly causes the body dissatisfaction, but many believe that body image issues develop when the young person internalizes and compares themselves to society's unrealistic and unattainable ideals about the human body that are often amplified by not so much mass media, but by social media, which is presenting some people or persons as perfect and with an enhanced appearance, which in many cases is fake and digitally altered from the original. Now, you know it, I know it. There's only one single thing that we need to blame that's causing all of this, and that is social media, our digital networking. Yes, unfortunately, social media has led to a poor body image for many women. That's because many people post on social media using filters that make them appear better with a glowing complexion, that hide all their little imperfections behind technology perks that are available on all platforms. There are many studies, and many, if not overwhelmingly, of the majority of expert opinions agree that engagement and participation in social media for the purposes of entertainment increases risk of body dissatisfaction and mental health issues. I have seen and taken care of young women who are absolutely gorgeous and hands down probably could make a living as models. However, they are mysteriously and magically plagued by insecurity and anxiety, and they lack confidence. And more so, they intimately believe that they are not attractive enough, comparing themselves to some digital ideal that does not exist. I absolutely blame it all on social media and engaging and looking at other people's fake stuff, because this is ultimately the reality. Most things in the digital space and on social media platforms are fake to such an extent that unless you're a very savvy, competent, and confident person, you really might have trouble distinguishing what's real from what's fake and fall into this spiral of negativity that you can never be enough or you can never compare to them. So I hope my opinion is clear on this. I'm very sorry, but I'm very opinionated about this issue. The truth is that social media platforms are creating a fake dystopian reality. It has nothing to do with most people's day-to-day world. As a young woman, you need daily human interactions with women and men of your own age, maybe younger, as well as with a variety of adults that are older, in order for you to develop a healthy, stable, optimistic, confident self-image. Ask yourself as a young woman, before you get into the nitty-gritty of listening to the other wellness things I'm going to talk about, how many people do you have today in your daily universe that you talk to either face-to-face or on the phone regularly? Because these two types of interactions are the only ones that count. Not texting, not posting, none of that stuff. Now, of course, if someone is far away and you're doing a face-to-face interaction using FaceTime, Zoom, Skype, WhatsApp, or any other platform, that counts. But that needs to be a person that you already know, a person that you have had the chance to observe in your environment or in their environment. Again, if you want to develop confidence and have a healthy, strong body image, use this as an opportunity for self-reflection on this topic. So pause this episode and think a little bit about where you are and why you are there. Now, once you've done that, you can resume. And I'm going to move on to the wellness check. After the height and weight measurements, and that's where I started with a detour, let's move on to the next part of the wellness evaluation. The doctor should take a detailed medical, surgical, family, and social history analysis and enter that data in your medical record. And next, the doctor should do a comprehensive review of all your health systems. Let me enumerate them really quickly and go over some questions that you might get. Constitutional system, overall energy, sleep, weight gain, weight loss, night sweats, vision and hearing, which means eyes, ear, nose, and throat evaluation, cardiovascular and respiratory system evaluation, done with very simple questions like, are you experiencing palpitations, heart complaints, respiratory problems, etc.? Then the doctor should move on to the very important digestive system, asking you about digestive health. This is where you want to share with your provider if you're experiencing constipation, diarrhea, or both, heartburn, bloating, or any abdominal pain. Remember that many women suffer from digestive health issues, and IBS is very predominant in young women. Next is joint health and muscle health. This is where you share with your doctor if you're experiencing any joint pain, stiffness, back pain, neck pain, or any achiness and stiffness, which could be a sign for a lot of things. Keep in mind, 80% of autoimmune disease happens in women, and autoimmune issues in young women are on the rise. The crucial telltale sign of autoimmunity is achiness and stiffness, which should be something that develops much later in your life, like in your 50s, never in your 20s. The majority of autoimmunity and inflammatory issues manifest with fatigue and achiness, so please be aware. Next is skin health. Are you experiencing any acne or any rashes? This is a crucial aspect of your health as a young woman. Why? Because your skin health is reflective of your hormonal balance and your digestive microbiome. Two key health issues that otherwise you might not think about. So talk to your doctor if you have unusual rashes or eczema, especially if you're experiencing acne. Many women focus on hormones as being the cause of acne, and in many cases, maybe the vast majority of acne, yes, could be caused by a hormonal imbalance, maybe something like PCOS. But a great majority of acne has a strong inflammatory component and has nothing to do with your hormones, but has everything to do with your digestive health. So instead of spending money, time, and effort on seeing a dermatologist, on trying multiple skincare regimens, or undergoing expensive laser therapy, please be aware that your skin is reflecting your hormonal balance and your digestive health. But I don't have any digestive symptoms, you might say. Well, the most seriously imbalanced dysbiotic people with bad microbiomes have no digestive symptoms. It does not mean you have a healthy intestinal tract if you have no digestive signs and symptoms. There are other telltale signs like imbalanced hormones, skin health problems, vitamin deficiencies, weight issues, etc. And obviously, these two things, hormonal health and digestive health, warrant much further investigation if you present with acne, eczema, or unusual rashes that come and go. So skin health, very important. Next, neurological health. Are you experiencing headaches, dizziness, vertigo? Do you have tingling or numbness anywhere in your body? The brain communicates with the rest of your body via your neurological system, which means the entire neurologically conductive pathways from the brain to the rest of your body. Your neurological health is intimately tied into your nutritional status, especially B12 vitamins and B vitamins. So those symptoms are very important to share with your doctor. Last but not least, actually this is not last because I have another one, is mental health and mental agility. This is where you want to talk to your doctor about experiencing anxiety, depression, irritability, insomnia, ruminating thoughts, mental fatigue, poor focus, lack of concentration, poor memory, and in general, mental fog. As a young woman in your 20s, you should never experience any of the symptoms I described other than maybe normal sadness from losing a loved one or a slight anxiety over an important exam, an important interview for a job, or your first date with a guy you're very interested in. Any other symptoms are abnormal. And now I made it to the last but not least review of symptoms is the genitourinary review of symptoms. This is where you want to talk about your periods to your doctor. When was your first period? Are your periods coming monthly or not? How long do they last? What's the flow? Do they have pain that comes and goes? Do you have PMS? Your hormonal health as a young woman, and that includes your sex hormones, your thyroid, your adrenal balance, will indirectly and directly reflect in how you get your period every month or you don't. I talked a lot about what's a normal period in previous podcast episodes, but I am going to shortly and briefly recap it here because I feel it's so important. So what are the 4 things that define a normal period? Number 1, your monthly cycle should be very reliable, and it should come every 28 to 35 days in your 20s. Expect your natural cycle to happen every 28 days or so, with a small variance of 1 to 2 days every time it happens. And this is natural cycles. This is not birth control pill governed cycles. Because once you take a birth control pill, your ovaries go on pause. It's like you've hit the pause button on a soundtrack, or you've shut down your computer or put it to sleep. So there is no natural hormonal cycle anymore. You have fake cycles from the birth control pills. So this does not refer to the birth control pills. Number 2, your period should last the same and be very predictable every cycle. Whether it's 3 to 4 days, 5 to 6 days, it needs to be the same length every cycle. If your period is less than 3 days or lasts 7 days or more, that is a sign you might be experiencing some ovarian dysfunction. That should not happen in your 20s. Number 3, the amount of blood loss that happens every cycle should be highly reliable and about the same. That is easy to measure and easy to describe. How many pads you use a day, or how many tampons you use a day. What's your heaviest day? How many? What's your moderate day? How many? And how many light days? And so on and so forth. That should be very consistent. If the amount of blood loss is unpredictable and it's light one cycle, heavy another cycle, that is a problem you need to discuss with your doctor. Do not dismiss it as normal. If your periods are heavy all the time, every cycle, month after month, that could be a sign of endometriosis, adenomyosis, or other types of ovarian health problems, like ovarian cysts or polycystic ovaries. So heavy periods, even though you've had them the majority of your life, does not mean it's okay. Number 4, your period should be free of pain, other than some minimal occasional cramping. If you need to take medication in order to function, if you throw up, if you curl up in bed and you're not able to go into work or go to school, you're having a problem. Severe pain with your period is a sign of either hormonal imbalance or a disease that's affecting your uterus or your pelvic organs, like adenomyosis, endometriosis, or uterine fibroids, which can happen in young women in their 20s, especially if their ethnicity is African American. That is how early fibroids occur in young Black women in their 20s. What else other than your period is a very important sign or problem that you might need to talk to your doctor about when you're a young woman in your 20s? Well, any unusual vaginal symptom, and that includes painful intercourse, vaginal discharge that has a smell, a different color other than white, or symptoms of irritation like burning or itching. I am not going to dwell on this issue here, but I think because I approached the subject of body image at the beginning of the podcast episode, I am going to have a quick word about body image as far as the appearance of a woman's intimate private parts. I am a gynecologist and I have taken care of women from as young as under 10 to as old as over 90 for over 30 years. Guess what? I have heard a lot of women ask me, does it look normal down there? And let me tell you something, ladies. The appearance of your private parts is as unique as a woman's face. If you have ever asked that question, do I look normal? Or wondered about what it should look like down there, look in the mirror at your face and ask yourself, what should I look like? What should my face look like? There's no specific way things should look like down there. There's a lot of variety. And I've seen a lot of women ask about changing the appearance of their intimate parts. There are a great number of gynecologists that specialize now in changing women's private parts appearance, which is a procedure known as labioplasty. It pays well, it's cash only, and it is rewarding for many women as it boosts their confidence in their sexuality. Again, the issue is, why do they need this boost of confidence? And why should they strive to have a certain appearance of their intimate parts? Now, I'm not going to dig into this as I believe it is a rather personal issue for many young women. But I will say one thing. The intimate, delicate, womanly parts will change with childbirth, will change with aging. And there are many technologies able to address such changes without excising and cutting away delicate tissue, without increasing risk of scarring, painful sex, or the risk of losing your ability to enjoy sex. I'm going to end here this little detour. But after all this review of symptoms during a wellness check, the next step should be the dreaded physical exam. So that would include a breast exam and a pelvic exam, perhaps a pap smear and collecting some samples. for sexually transmitted infection screening, which is highly recommended for any women under the age of 26. Why? Because chlamydia has no signs and symptoms and is very serious in its consequences for infertility, chronic pelvic pain, and the risk of ectopic pregnancy. Last but not least, as part of your wellness check, the doctor would test some general wellness markers: kidney, liver, cholesterol, a complete blood count, a complete thyroid panel, and your vitamins. I would like to end this podcast episode with a very important wellness marker that is not considered probably by any physician during a wellness visit for a woman in her 20s. This is the time in a woman's life when most women should start asking themselves about their desire and ability to have a family and to bear children. It is not a mystery that we are dealing with an infertility epidemic and an infertility crisis. 30 to 50% of couples have difficulty conceiving, depending on their age range. It is also common and a well-known fact, and unfortunately not frequently discussed during a wellness visit, the simple reality of a woman's maximum fertility potential is in her 20s. Fertility capacity and ability to reproduce successfully declines after the age of 30, declines much quicker after 35, and very, very, very rapidly after the age of 40. That is not something that happens with men, only with women, because women are born with a certain amount of eggs. And those eggs, it's not all about the number, but it is all about the quality. And the quality of our ovarian eggs has maximum potential for fertilization in our 20s. And that is something that needs to be discussed with every woman that comes and has a wellness check between the age of 20 and 29. Now, obviously, this doesn't mean that everybody who wants to have a child after 35 has to harvest their eggs and put them in cryostasis in an egg bank just in case. I am not sure that we are in that dire of a situation where it should be standard of care recommendation, but maybe we're going there at the rate of fertility dysfunction we are seeing in young women. I guarantee you that the majority of doctors providing your wellness exam, if you're a woman between 20 and 29, will not discuss with you checking your ovarian reserve. The ovarian reserve is a pretty good indicator of overall ovarian health. And I firmly believe that it should be a health marker widely used and recommended for women who do not wish to bear a child until after 30. This test is called the Mullerian hormone test, or the AMH test. It is very useful to be interpreted by a knowledgeable physician because a high value, over 10 or 11, indicates the possibility of PCOS, whereas a very low value, and again, that's interpreted on a Bell's shape curve statistical analysis distribution based on age. So a low value would indicate premature ovarian failure. We can detect premature ovarian failure with this test, as well as other tests, when the AMH is low in your 20s. Now, that is when the young woman should be counseled for egg freezing, as preserving your eggs when you're young ensures your fertility potential remains intact and safeguarded. Plus, your parents should still be working and making some reasonably good money, and they should be able to help you finance this endeavor, because obviously it will not be covered by your insurance company. Hopefully, you have gained a lot of knowledge about wellness check for a woman in her 20s. You have heard some interesting stuff about body image, about ovarian dysfunction, about fertility testing, and about a comprehensive review of symptoms. If you feel that you have not had a wellness check that touched on all these points, please come see us at Hera Beauty and Wellness. This is how we do the wellness checks for most of our patients. Obviously, depends on time, depends on if we're going to build a visit to the health insurance company. We might need to split it in 2 or 3 visits, but we will hit all these points. I will continue next episode with the wellness markers for women in their 30s. and 40s because they are different and they will need different wellness markers and different considerations. So come back next week. Thank you so much for listening. If you are one of my faithful listeners and you are finding value and enjoying these episodes, please feel free to leave me a review on whatever platform you're listening to. Also, if you find the content in these topics useful, not just to you, but to someone else, a friend, a loved one, or simply an acquaintance that you know could benefit from the knowledge I share here, please feel free to forward my podcast to them. If you live in California and you'd like to work with our practice to help you achieve your wellness goals, please go to our website, www.herabeautyandwellness.com, and request an appointment. It will be our privilege to help you in any way, shape, and form we can. Any suggestions on a topic of beauty, wellness, or anti-aging are welcome. All you have to do is go to the website, leave a suggestion into the AI chat, and I promise you if you ask, I will listen and add your suggestion to my list of topics that I want to get to as soon as possible. Please join our Facebook group, The Wellness Optimizing Warrior MD. It's a small growing community that focuses on wellness, on what's new, what's safe, and what works in beauty, wellness, and anti-aging.